My name is Soneesh Kothagundla, and we're on a mission to rewrite the story of lung cancer, from silence to survival. Today, we're diving into how innovative advocacy can drive real, measurable change in one of the most overlooked areas of medicine, lung cancer screening. And you can find us on Instagram, Twitter, and LinkedIn, and on our website, alcsi.org. And today I'm speaking on behalf of the American Lung Cancer Screening Initiative. So just a little bit about me before we dive into the lung cancer world. Let me quickly introduce myself. My name is Soneesh Kothagundla. I'm a health advocate, a researcher, and I'm a rising senior in high school based in Atlanta, Georgia. You can also find me on Instagram, Twitter, and LinkedIn. So the problem is lung cancer. Lung cancer is the #1 cause of cancer-related death worldwide. But here's the kicker. It doesn't have to be. We have a solution, and that's early detection. A simple low-dose CT scan can reduce the risk of dying from lung cancer by 20 to 33%. So what's the problem? It's the lack of awareness. Most people don't even know that they qualify for lung cancer screening. But if you're between 50 to 80 years old, smoked a pack a day for about 20 years, a pack of cigarettes, and still smoke or quit within the last 15, you should be screened. And if someone matches these criteria, this screening is most likely covered by insurance. And this gap of knowledge is costing lives. And that's where we come in. The American Lung Cancer Screening Initiative is fighting this with advocacy, with outreach, and with action. And now here's where it gets exciting. This isn't just like a one-person mission. It's a movement. We built a network of 103 ALCI chapters across the US and Canada, right in the heart of schools, colleges, and universities. From UCLA to Yale, from the University of Puerto Rico to UBC in Canada, students are stepping up everywhere to spread awareness about lung cancer screening. And why students? Because we bring energy, creativity, and the ability to make public health viral. Okay, now this is what advocacy looks like. From the White House meetings to high school classrooms, from tabling at college campuses to, yes, even helicopters, our movement shows up everywhere. Proof that young people are leading conversations on lung cancer screening in schools, in communities, and in government buildings. Every one of our college chapters runs public outreach, tabling events, poster drives, classroom talks, rallies, and whatever it takes to get the message out. Our ALCI team worked hand in hand with the US Senator Tina Smith's office to draft and push forward Senate resolutions that officially recognize November as National Lung Cancer Awareness Month, while also urging early detection nationwide. And we've done it for 5 years in a row. And this bipartisan win shows what's possible with advocacy and action. All that aside, now I want to talk about my advocacy initiatives within ALCI and the initiatives that I launched. Okay, so here's one of my favorite stories and the one that Julie was talking about earlier. So picture this, I'm 30,000 feet in the air. I walk up to the flight crew after takeoff and ask, hey, can I give a public service announcement about lung cancer screening? And they look at me, I smile, they say, go for it. And so here's just a quick video that I'm gonna play.
Did you know that lung cancer is the leading cause of cancer-related death worldwide, but it doesn't have to be thanks to early detection. So if you know anyone over the age of 50 who has a history of smoking, make sure to tell the doctor about lung cancer screening. Lung cancer screening is a quick CT scan that lasts 5 minutes, which can save someone's life. It is covered by most insurance in the world. Thank you so much and have a safe travel.
Aw, yay! That's so good.
And now we're normalizing advocacy at 30,000 feet in the air. And the wildest part is when I got upgraded to first class, and also when a thoracic surgeon came up to me afterwards, and then we just talked about lung cancer screening. And in total, I gave about 4 flight announcements, also counting, I'm gonna keep doing it, which reached about 600 people. And this is also another initiative that I started, which I'm very proud about. So first, here are bus shelter ads that are about to go down in Las Vegas this June, and we're getting 50 of these. And on the right is a billboard, and we have over 27 billboards in cities all around the nation, and we're at a total of 5 million impressions and 100,000 plays. This image on the bottom right just shows all the billboards we have in the Atlanta area. Okay, yep, you saw that right. That's a donut. Because let's be honest, who expects public health messaging on a Boston cream? But that's exactly the point. We're in the process of partnering with Dunkin' to create custom donuts that turn breakfast into an advocacy effort. And we're hoping to launch it this November, Lung Cancer Awareness Month. And so our final message is, After everything you've seen, from classrooms to the Capitol, from donuts to digital billboards, it all comes down to one simple message. Lung cancer screening saves lives. And our mission is to put lung cancer screening information in front of as many people as possible. And now this is where you come in. We're launching the High School Lung Cancer Screening Innovation Challenge, a free international competition for high school students to drive the future of advocacy, research, and policy. The mission is simple. Create a solution that raises awareness or increases access to screening, or develop a proposal for innovative research in this field. And then finalists will fly to Boston for our annual leadership summit to present their ideas in front of doctors, researchers, and public health leaders. If you're interested in sponsoring, I would love for you to contact me at my email in the yellow box, or simply you can message me on Zoom and I can contact you. Thank you so much for listening.